Hello, sir. My name is Manette. I'm going to assess you again since you do the paper, the consent paper. So we're going to do cranial nerve 1. So I'm going to ask you to close your eyes, and I'm going to close your eyes and smell this. And tell me what you smell.
Vanilla extra.
Vanilla extract. Very good. This is cranial nerve 1. Cranial nerve 1 is intact. So we're gonna assess for cranial nerve 3, which is oculomotor, trochlea, and abducens. So I'm gonna ask you to, I'm gonna move that pen light toward you, way toward you, and I'm gonna move it from the 6th cardinal gauge, and I'm gonna ask you to look at the pen direction. Okay, you just this is cranial nerve 3. Now I'm gonna assess your pupils. So I'm gonna ask you to look straight, and I'm gonna ask you look at your pupils. They dilated 3 centimeter, reactive to light. I'm gonna ask you, I'm gonna move the pen inward, and I'm gonna move it. Look at the pen. This is accommodation. So cranial nerve 3, 4, and 6 are intact. I'm gonna check for your lungs. So I'm gonna percuss your lungs. So what I'm gonna do, this is a second intercostal. I'm gonna percuss. I'm gonna listen to your lungs. I'm gonna check for bronchophony. I'm gonna ask you to say the word 99. But I'm listening to your lungs.
99. 99. 99. 99. 99. 99. 99. 99. 99.
This is I'm assessing for bronchophony. So actually, so I'm gonna ask you to stand up. We're gonna do the visual field by confrontation. So I'm gonna ask you to cover your right eye. I'm gonna ask you to cover your right eye, and I'm gonna cover my eyes. I want you to look at me. Look at me, look at my eyes. So how many fingers you see?
2.
I'm gonna also go up. How many fingers did you see?
2.
Very good. We're gonna do the other eye. I'm gonna ask you to cover your left eye. So, and you're gonna look at me straight, and I'm gonna cover my eyes. So I'm gonna ask you to tell me how many fingers you see.
2. 2.
Very good. So this is visual field by confrontation. So I'm gonna ask you to turn your side. I'm gonna percuss your posterior thorax. Also, I'm gonna assess for CVA tenderness. I'm gonna from the 5th intercostal intercostal margin. I'm gonna assess for severe tenderness. I'm gonna ask you to, I'm gonna stamp the liver. This is the kidney. I'm gonna stamp. Do you feel any pain?
No.
Do you feel any pain?
No.
This is severe and tenderness. I'm gonna ask you I'm gonna ask you to expand to take a deep breath. Take a deep breath. As you see, she is taking a deep breath, so you can see that my hands are expanded. So I want you to sit. Can you lay down? Oh, before we can do cranial nerve 5, which is trigeminal. So I'm gonna ask you to look up, and we're gonna check for corneal blank reflex. So can you just look up, please? And I'm gonna touch your cornea. So I'm gonna pretend that I'm gonna touch the cornea. So this is for corneal blank reflex, which is a cranial nerve 5. Thank you. So now we're gonna check for I'm gonna ask you to lay down for me. So we're gonna check. Can you lay down a little bit? Okay. So I want to see your neck. We're gonna check for his carotid. So I'm gonna look for pulsation. So I'm gonna check the carotid one at a time. I'm gonna go to the left side. Turn your head toward me. I'm gonna listen with the diaphragm of the stethoscope to see if there is no bruit. Can you take a deep breath? Okay. I'm gonna listen to your heart, okay? So from the second intercostal, this is the aortic valve. Gonna go to pulmonic valve. We're gonna go to the tricuspid valve, and then we're gonna go to the mitral valve, which is at the apex. Can you turn to the left side, please? I'm gonna oscillate to the left side. I'm gonna oscillate at the mitral valve at the apex with the bell of the stethoscope for the S3 heart sound for 1 full minute. All right, thank you. So now I'm gonna palpate your abdomen. Can you go back to your side? I'm gonna palpate your abdomen. I'm gonna start from the right lower quadrant. From the right lower quadrant, I'm gonna inspect, and I'm gonna study from the right lower quadrant. So light palpation.